am currently 40 weeks pregnant, filming this before I head out on baby leave because I'm noticing such a big problem with over-medicalization in the healthcare field. I'm not going to go into depth on that. There will be a series of videos going over the top 5 with one bonus, so technically 6, diagnoses that people are labeled with that I think are kind of BS and don't give you the direction that you need in order to treat your pain. If you want to learn more about each in depth, I have a free resource. I'm just going to drop the link in the comments and you can grab that. But what I'm going to do in this video is break down SI joint dysfunction. So this is often used as like a catch-all label when someone has low back, hip, or pelvic pain that doesn't fit cleanly into like a disc, a facet, or any kind of hip diagnosis. So it's really just this big umbrella term. And the reason why it's misleading is because the SI joint is a tough, stable joint that has a lot of ligaments surrounding it. So it's really, really strong. So true instability, like after trauma, pregnancy, or even inflammatory diseases, are really rare. There's also no gold standard to definitively diagnose SI joint dysfunction. Typically things like hip mobility, hamstring or abductor imbalance, lumbar instability can all mimic SI joint pain. Pelvic floor tension or discoordination can also present as SI joint pain. And to give you an idea too of where this typically presents, it's this area right here. This is your SI joint. And it's really not meant to move that much. So when we say that there's SI joint dysfunction or SI joint instability, it's actually really difficult to move that joint enough to classify it as any kind of instability. The more accurate lens is to really view it as a whole system coordination and load distribution problem, not necessarily an unstable joint. So where does this pain actually come from? Typically, it's from a load versus capacity mismatch. And the cause of, you're going to hear me say load versus capacity a lot in this series because the cause of 99.9% of pain and injury is a load versus capacity mismatch, which means that there's too much load on the tissues in that area relative to their current capacity, which can be changed with intentional training, which is what I'm going to show you today. The pain in the SI joint can also come from poor coordination of your abdominal canister, which is your diaphragm, your pelvic floor, and your transverse abdominis, which is one of your deep core muscles, and your multifidi, which is some of the muscles on your backside. SI joint pain can also stem from dysfunction in the foot and the ankle. For example, like if we have loss of stiffness or any kind of overpronation, that can drive compensation in the pelvic floor tension or SI joint irritation. We can also have weakness or instability in the posterior oblique sling, which is your lats, your thoracocolumbar fascia, and your glute max. And that sling goes across your back. So you take this lat, the thoracocolumbar fascia, which spans your back, and then down to the opposite glute max, or the lateral sling, which is your glute med, your abductors, and your lateral core, which then will alter force through the SI joint, and again, force it to hold more, do more capacity, or do more load than its current capacity. And that's typically where we see that pain show up. So when it comes to SI joint dysfunction, aka non-specific hip and low back pain, we don't want to chase the joint, okay? We need to look at the whole body sharing. We need to restore hip mobility and strength balance in the abductors versus the adductors, the hinge versus the squat. unilateral versus bilateral strength. We need to train the deep core and the pelvic floor to coordinate pressure and stability. We need to rebuild confidence through graded exposure and avoid this cycle of flare, rest, overload again. So I'm going to show you how to do all of that with 3 simple exercises you can do entirely from home with just this yoga block and a will to live. So the first one we're going to do is bear plank lift-offs. So you can place the block in between your knees, and we're going to squeeze the block, okay? You are going to take a big deep breath in, really let your belly hang. And then you're going to breathe out and imagine someone's going to punch you in the stomach. We are not sucking in, we are creating a wrap around our stomach to engage that transverse abdominis, okay? So you're going to breathe in, out, squeeze the block, and lift. Hold for 5 seconds here. Relax. Do it again. And you're going to repeat that 10 times for 3 sets, okay? So let's do a couple reps together so that you get the idea. So we're breathing in, out, lifting the block, 5, 4, 3, 2, 1. Lower back down, reset. Breathe in, out, lift, 5, 4, 3, 2, 1. What this exercise does is we are training the transverse abdominis, the diaphragm, the pelvic floor, the adductors all together. So that's addressing one reason why you might feel pain in the SI joint. The other reason that we mentioned was foot dysfunction, like lack of mom brain, I'm losing the word, loss of stiffness or overpronation. So what we can do, you're just going to see my feet for this one. Sorry, my belly hangs out. I have no clothes that fit me at this point. So you're going to stand like this with one foot, and you're just going to keep, you want to dig your big foot, your big toe, your little toe, and your heel into the ground and keep them there. So you're kind of like clawing the ground. Not too hard. If you have your sock off, you shouldn't see your toes turn white, okay? So we're not digging so hard in, but we're creating a stable base. And then we're just going to rotate over, keeping the big toe down, and rotate back out. Rotate over, rotate back out. So what this is doing is causing our foot to change position, move in and out of pronation and supination, which is where the arch raises and then the arch flattens. I'm going to show you from the side view as well. Let me roll up my pants so you can kind of see my foot here. So we're here. As we come over, the arch lifts. And then as we pull back, the arch flattens. Keeping our toes and heel on the ground at all times. For those, I like to dose those in time. So this way you slow it down and not try to rush through reps. Typically I say 60 seconds each side, 4 to 5 rounds. And you're going to repeat this circuit that I'm giving you. We have one more exercise. You're going to repeat this at least 3 times a week. Realistically, you can do this at home. It should take you 10 to 15 minutes. If you've been dealing with chronic pain and you can't dedicate 10 to 15 minutes to your healing every day, you don't want it that bad. So I'm giving you the easy way out here. Last one is going to be a side plank. to help target the weakness in the abductors. So you have a couple options here. First, we could do a side plank like this, right? You can keep the foot. This is so basic. Easiest progression is just to hold it here. You want to be able to, if you can hold that comfortably for 30 seconds, too easy. So then from here, we can now lift the foot. Same thing, 30 seconds there, too easy, move on. So now we straighten legs and we come here and then here, okay? You could also add in hip dips. So you could be here and add in some dips. You could add rotation to get some of that oblique sling, right? So we can come up here, we can rotate under and back up. So pick a variation that feels challenging yet comfortable. Your pain tolerance, your pain range should stay between a 3 to 4 out of 10. We can go up to that because we don't want to completely avoid pain. If we completely avoid pain, then we don't give our body, our nervous system, the opportunity to adapt and overcome. So we do want to push into a little bit of discomfort, but not so far that we're causing a flare-up or a huge irritation. So the way that I would dose that, again, pick a variation that's challenging and keeps that discomfort level between a 3 to 4 out of 10. And I would dose that with 30 seconds per side, 4 rounds. So to recap, bear plank, knee lifts with the yoga block. You're gonna do that 5-second holds, 10 reps, 3 to 4 sets. Then you're gonna do the foot supination, pronation. That's the standing one where you rotate. You're gonna do that for 60 seconds each side, 4 to 5 rounds. And then you're going to do a side plank variation that is challenging. We don't want it to be easy. Staying within that 3 to 4 out of 10 pain range. And 3 to 4 out of 10 is for every exercise that we're doing in this video and in this series. And you're gonna do those hip dips, 30 seconds each side, not hip dips, side planks, which are a variation, 30 to 60 seconds, 3 to 4 rounds. And you're gonna do that 3 times per week. Obviously, on top of that, we wanna make sure nutrition is on point, hydration is on point, sleep is on point. Get to work, and I'll see you in the next one.